Hey everybody, this is Dr. Blackburn again from Atlanta Prosthodontics. What I wanted to do today was kind of let denture patients understand some of the questions and concerns that you may have about dentures. So let's quickly talk about regular dentures, immediate dentures, and implant overdentures or implant supported dentures, okay? Immediate dentures. If a patient has failing teeth and the teeth are loose due to periodontal disease or gum disease, and they know that all of the teeth that they have remaining have to come out, then we will fabricate them some immediate dentures. And these are just two examples of regular dentures. Dentures are made out of acrylic and they come in different types of teeth. Some of the lesser expensive teeth don't wear quite as long. Some of the more expensive teeth have an additional layer of acrylic so they look better and they last longer. But the whole process of immediate dentures, there's a lot of YouTube things going on about immediate dentures with patients, saying how traumatic it is and everything. It's not that bad. It's something that we at Atlanta Prosthodontics do every day. What we do as differently than some of the other offices is that we take out the posterior teeth first, the teeth in the back. Then we get started making your denture. We keep the front teeth there. So the appointment that you come in for your final delivery of your denture, that's when we take out the front teeth and then the denture goes in place. So you won't have to walk around without any missing teeth at any time, and it's less traumatic than taking out all of the teeth at one time that need to come out. That's the difference of an immediate denture, okay? The alternative is a regular denture. If a patient has had all of their teeth out at one particular time in the past and they simply want a new denture, it takes us 4 visits to fabricate a new set of dentures. I'm a specialist, I'm not a general dentist. You go to a place, you know, like Affordable Dentures or like Aspen, one of those corporate denture places, and they say dentures in one visit. Well, I simply say, you know, the human body wasn't made in one day, or you can't Google this stuff. It has, it's almost like a custom fitted suit. You can't make these prostheses very well in just one visit. We need time to go by and take a bite registration or to take certain measurements of your mouth, and that's what we need to make you a good, satisfactory product in the end. All of our patients get to see the teeth before it's fabricated, and they have to sign off on a form saying, hey, I like the way it looks and I approve the appearance. And so when we deliver at the 4th and final visit, they had already, you know, seen the teeth. And that's a little different than a lot of the other places get to do. The next thing I want to talk about is implant dentures or implant supported prostheses. Now, on TVs and on commercials, they talk about, oh, come on in, get teeth in a day. It isn't that traumatic. You won't have to go back and forth. Well, almost that's a bunch of malarkey. Because yes, you will have to go to those offices to get impressions, to get bite registrations, and so they know what types of implants to order and everything. But yes, on that very last appointment, after you have all the workups and everything done, you will, you know, get a temporary denture in that day. But mind you, you will have already had seen them for a couple of visits beforehand, and that's the same way at Atlanta Prosthodontics. Now, what I do differently than what a lot of other offices do as a specialist, what a lot of my patients need are simply denture stability. When the patient's lower ridge, and I have an example here, when their lower ridge goes goes down. If there are not any teeth in the ridge of the mouth, the denture is simply going to flatten, the architecture of the ridge is simply going to flatten out like a pancake. And when the person just has their teeth out, there's a nice ridge of bone here. And over time, if there's nothing in the mouth, if there's no teeth or if there's no implants in the mouth, the bone flattens out. So then the denture does not have what we call good lateral stability. The denture starts to move around. It's almost like if you were to place this denture on a flat surface, well, it'll start to move around because it doesn't have any lateral stability. So what I do is we simply place, a couple of implants here on the inside of the dentures, and that will allow the patient to snap it in place. And it works just like the snaps on your blue jeans. And what it does is it gives the patients retention to where they're either their lower denture or their upper denture. And it makes the bone last as long as it can, and it provides adequate retention. Now, you don't have to spend $40,000, $50,000, $60,000 that the people on TV say, oh, come on in, we'll do all on four, we'll give you this, and then they have a person to come in the room and say, hey, well, it's just $50,000, $60,000. You can get a second mortgage on your house. Well, what we do here at Atlanta Prosthodontics is most of our treatment is less than $10,000 for the surgery. What we do here is we place narrow diameter implants, and these narrow diameter implants is from a company that I'm not being paid at all to sponsor, but I do the Lodi locator implants, and they are slightly narrow in diameter. They are larger than what's considered a mini implant, but they are smaller in diameter than the average standard implant. That's all you need to stabilize a denture and to keep the bone where it is. Now, sure, if some patients say, hey, doc, we don't want to be able to take the implants in and out at all, well, then we have to go to another alternative where, yes, you'll need a larger implant. But if you want your dentures to be stable, to snap in, and to go eat steak or chicken or to enjoy your food, all you'll need is a narrow diameter implant. We do that all day, every day here at Atlanta Prosthodontics. I place the implants, and it's more than less than half the cost of standard implants. So you don't need to take out a second mortgage on your home. You don't need to fear coming to the doctor. It only takes a couple of hours to actually place the implants. And what I usually do is once I place the implants, I usually put a soft material inside of your current denture, and you will go home, get accustomed to that. I usually bring my patients back, in about 2 weeks, and hey, at that point in time, I usually put those snaps in the dentures, and you'll be able to click it in and click it out. So please give us a call here at Atlanta Prosthodontics. Look us up, and I've done a few videos that patients have been watching. If you want to see a surgical procedure, just look on my website at www.atlantaprosthodontics.com, and my information will be down below shortly. Thank you very much. And if you have any questions, and if you are in the Atlanta area and want to come on in and give us a call for an alternative to some of the higher prices that you've been seeing, let us know. If not, we have patients all over the Southeast. All we need is time to come in and accommodate you. But this is a much better alternative than a lot of what the general dentists are doing, or what the big corporate companies are trying to almost railroad a lot of patients with these extremely high costs. it's not a deal breaker as many of you all would think. So please give us a call and come on in. Thanks much.